Namaskar. Welcome to this episode about information on postnatal depression. My name is Dr. Namita Singh. I am a consultant psychologist at Apollo Hospitals, Hyderabad. Postpartum depression is a condition which many a time few to many women face after delivery of a baby. It may cause disruption or it may smoothen up over time. Today we are going to look into the various facts, information around the psychological factors of postpartum depression. What is postpartum depression? Postpartum depression is a psychiatric condition comprising three categories. Postpartum blues, which are small changes in behavior which usually occur in very many women post delivery but can go away with basic reassurance. Then there is postpartum psychiatric disorder which results into extreme behavior. It usually starts within 4 weeks of the delivery, needs medication and may require hospitalization. Then comes the postpartum depression, which is incidentally quite common but not identified. There is a study by Upadhyay and Chaudhary which indicated almost 22% women in a sample of 20,000 more than women having postpartum depression, where they may feel low, irritable, have mood swings, feel like crying, or may just feel wary of everything. What are the symptoms of postpartum depression? It may have mood changes, anger, guilt, feeling accusing, feeling overwhelmed, feeling restless, feeling guilty, or just feeling overwhelmed by the responsibility of the new baby and the changed environment. Cognitively, it may show lack of attention and concentration, feeling of forgetfulness, or feeling foggy in the brain. Again, in terms of behavioral issues, there can be crying, there can be feeling of feeling ashamed, having a feeling of not being a good mother, getting suicidal thoughts, or feeling extremely wary of the baby. Sometimes a new mother or a lady can feel harmful towards the baby, which brings in more psychological distress. What are the main causes of postpartum depression? Low maternal age, high maternal age, low maternal education, history of previous mood changes, anxiety, psychiatric condition, family history of psychiatric condition, poverty, impaired relationship with the spouse or partner, having a scenario of marital conflict, domestic violence, addictive behavior in husband, or severe financial difficulties can cause. Lot of reasons for postpartum depression. What is the largest reason for postnatal depression? I would rather infer this question, what is the alarming situation in postpartum depression? If an individual, if a lady is feeling very threatened, has self-harm ideation, or feels like making some harm or doing something harmful to the baby, then it is a red flag area. There can be very many causative factors. It is important for the individual to reach out to the spouse, partner or loved one and seek help. There are suicide prevention helplines, there are other psychological distress helplines. Make sure you talk to your doctor, reach out to a mental health professional and you will be out of the condition. How does postnatal depression affect the brain? Clinical research has shown that there is changes in the brain circuit system, there is neuroinflammation, there is neuroendocrine changes, there is a drop in the hormones in the lady's body as estrogen and other hormones. The thyroid hormones also change, so the person can feel sluggish, depressed and in low mood. There is evidence that these biological changes and the biochemical changes can further aggravate depression in a new mother. But there is medication if there is a previous history that a woman has had in a previous pregnancy or another medical condition. It is important to inform your treating gynecologist, obstetrician, and seek immediate help. Then it won't get into severity ratio. How is postpartum depression treated? There are multiple modalities depending on the severity and the duration, right from medication prescribed by a psychiatrist and adherently complied by the patient. Have a small routine in your own capacity. Go out with your baby for a small walk in the sun. Get adequate rest. Don't be overwhelmed by the new responsibility. Take it easy on yourself. The woman has undergone a major change in the body. Although birthing is a natural process, but because we have a more or less systemic social support system, it is okay to reach out. Cut down on your extracurricular responsibility for the time being. Adhere to good exercise routines in terms of walking scenarios, mild relaxation, breathing exercises. Adequate nutrition is very important. Very many times new mothers in the just for taking extreme care of the baby and the change role do everything on their own. They become overcautious, which can result into mood changes and increase in fatigue and then mood depressed state. So in all, it is important that any new mother or would-be mother start practicing a bit of relaxation, self-compliance about emotional regulation, be informed about the plans for pregnancy, take care of your general health overall, avoid nicotine, avoid psychotropic drugs and alcohol. They surely aggravate the depressive mood states and can eventually harm the baby as such. There is always help available around. Reach out to a mental health professional or your treating doctor, and you may not require immediate serious intervention in terms of having to suffer any kind of postpartum depression. It is always okay to be well informed rather being worrying or getting wrong diagnosis or making things complicated for yourself. Wishing you a good and healthy lifestyle and better choices. Thank you. Namaskar.